33% of global preventable deaths per year are attributable to just four industries: tobacco, unhealthy food, fossil fuel, and alcohol. While these industries rake in billions by manufacturing sickness, doctors are left holding the bag and blamed for rising healthcare costs. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal. I'm a primary care physician in Connecticut, and I run my own medical practice. Commercial industries profit from addiction, pollution, and overconsumption, and are one of the major engines driving chronic disease in the population. These industries shape the food we eat, the air we breathe, and the habits we form. In this video, I'll show you the tactics these big companies use to drive consumption of harmful products and manufacture sickness in the population. We'll talk about a relatively new field of study, the commercial determinants of health. Let's dive in. The field of commercial determinants of health is relatively new, and there's no single widely accepted definition. The earliest mention and definition of CDoH that I could find was by Caswell in 2013. It defines CDoH as factors that influence health that stem from a profit motive. The WHO defines commercial determinants of health, or CDoH, as private sector activities that affect public's health positively or negatively. And the Lancet Commission defines commercial determinants of health as the systems, practices, and pathways through which commercial actors drive health and equity. The reason to study commercial determinants of health, or CDoH, is because currently there's a huge focus on wellness and prevention. What we don't realize is that large companies and industries often profit from addiction and selling harmful products, which is one of the major causes of population-based illness, as these lead to chronic medical problems. Doctors, especially primary care under value-based care, are asked to keep people healthy, but often we are fighting an uphill battle against these billion-dollar industries. One of the most influential strategies that these companies use is marketing and advertising to promote their unhealthy products and change behavior. Common culprits here include tobacco products, including not only regular cigarettes, but also e-cigarettes, alcohol, which is normalized and glamorized in marketing and media, and highly addictive processed sugary foods that are engineered for overconsumption. And to make things worse, a lot of this marketing is targeted towards people with lower socioeconomic means, which leads to the difference in healthcare disparities. The companies always argue that it is their First Amendment right to express free speech and promote these unhealthy products. Another strategy is product pricing. The companies deliberately price unhealthy products to be cheaper, especially by volume, than their healthier counterparts. They also use discounting strategies to ensure that they're selling these products. On the other hand, healthier products are generally much more expensive and unaffordable for people with lower socioeconomic means. Let's look at how CDoH creates an environment and culture to push lower-income people to consume and get addicted to sugary drinks. Companies often advertise bottled water as pristine, natural, and purified, linking it to being better for health and as a status symbol. This narrative positions it as superior to tap water. While rarely making direct false claims about tap water, which could lead to legal issues, the industry capitalizes and amplifies public concerns about tap water quality, such as lead in water, that water needs to be boiled before it's safe to consume, or tap water has a chlorine taste, which indirectly implies that people are drinking chlorine. This two-pronged marketing approach suggests that tap water is bad and bottled water is good, which creates a market for bottled water. Since bottled water is expensive, companies place their high sugary drinks next to bottled water and price them lower than bottled water, and also frequently discount them. People with lower incomes who have already been primed that tap water is bad and are looking for bottled water are attracted by the low price of sugary drinks and end up purchasing them. They then become addicted to sugary drinks and don't like the taste of water anymore and continue to buy soda. This is called manufactured consent. Essentially, what manufacturing choice and consent mean is that large companies use advertising and marketing to create desire and change behavior to shape preferences. This is often done by manipulating the environment, which may include product placement and price nudges towards unhealthy products. Once people start consuming unhealthy products, they become addicted to them, which continues to drive up consumption. And then companies deflect responsibility for health outcomes by framing this as a personal choice. People have healthy options. They choose to buy soda, so we sell it. Another strategic tactic that companies often engage in are activities that appear beneficial to society or the environment, but are really designed to deflect attention away from harmful products or practices so that companies can protect their reputation and profits. and also avoid potential backlash that may lead to regulation. They do this by philanthropic endeavors and community engagement initiatives. Think about prescription health programs from large companies to deflect attention from high drug prices, cultivating a favorable public image and building trust with consumers and stakeholders. Think about Coca-Cola's and Pepsi's campaigns promoting physical activity and calories in, calories out narratives, or the alcohol industry's Drink Responsibly campaign. And by creating a positive association with their brand, such as America Runs on Dunkin', evoking national identity and patriotism. At the end of the day, these campaigns are designed to protect companies from regulatory action, which will hurt their profits way more than the money they spend on these trust-building campaigns. Probably one of the best campaigns on corporate America's influence in policy and regulation is the recycling corporate lie that was sold to the US. Let's walk through how corporate America led us to believe that recycling is the answer to pollution. Post World War II, large companies started packaging products in single-use plastics such as soda and water bottles. This led to ever-increasing industrial waste and pollution. People started becoming upset with this pollution and began calling for bans and regulations on production of these plastic packaging products. In response to this backlash, the packaging companies created the Keep America Beautiful nonprofit coalition. In 1971, this coalition launched their Crying Indian ad, featuring an Italian-American actor, Iron Eyes Cody, representing a Native American shedding a tear due to the destruction caused by plastic pollution. If you've not seen the ad, I would strongly encourage you to do so on YouTube. Just before the actor sheds a tear, the masterpiece moment in the ad shows people throwing plastic waste towards him. This visual of people throwing trash towards a person who's worried about the environment was extremely successful in shifting the blame from industries producing these packaging products to individuals. In fact, the punchline of the ad was, "People start pollution, people can stop it." This ad successfully directed attention away from the production of plastic packaging products towards consumer behavior. Since public backlash decreased due to misdirection, the large companies were able to defeat all regulations that would have put meaningful restrictions on the production of plastic packaging products. And today, we still have a huge amount of plastic waste that is being generated. But the idea of recycling is so ingrained in so many of us that we continue to faithfully recycle. Keep America Beautiful organization's Crying Indian ad is still considered a masterpiece in narrative control, disguised as corporate social responsibility and lobbying effort to deflect blame and regulation. And this strategy is employed frequently by almost all large companies. For example, soda companies stress freedom to choose, promotion of physical activity, and sponsoring events and lobbying, all of which are extremely successful in avoiding regulation, such as taxation on sugary drinks. Let's apply this strategy to healthcare. Large companies spend billions of dollars on marketing and promoting unhealthy products. Population health continues to decline and rates of non-communicable disease continues to rise. When people start getting upset and demanding answers, large corporations deflect responsibility to the healthcare sector to hold doctors, especially primary care, responsible and accountable for keeping people healthy and penalizing them for poor health outcomes. Due to successful misdirection and implementation of quality improvement and value-based care programs, attention shifts from the role of commercial actors in causing disease to the healthcare sector in keeping people healthy. These large industries escape meaningful regulation. This strategy is not very different from that employed by Keep America Beautiful, and yet most people don't understand this and keep doubting that doctors are the problem. I have news for you. If we regulated these industries, most people would not need doctors, or at least need them a lot less, and healthcare costs would decrease. Now let's look at some supply chain and labor practices. You might not be able to see the flowchart in detail, but this is available on pcplens.com. In the US, the supply chain managed by large fast food companies is to prioritize ultra-processed, high-fat, high-sugar food products over fresh produce. These supply chain practices reduce the cost of these products, which are then heavily marketed to people, especially in the lower income range, leading to an increase in incidence of non-communicable disease such as heart disease, obesity, stroke, and diabetes in this group of people. For instance, the proliferation of food deserts in many urban areas where fresh food is scarce, but processed snacks are abundant, is a direct consequence of these supply chain priorities, which disproportionately affect people with less socioeconomic resources, leading to not only health disparities and ability to access or afford healthcare. But hey, people have a choice to buy healthy food. If you think supply chain is not the root cause of this, let's look at how some of these fast food companies position themselves in the US and compare it to the rest of the world. Due to supply chain efficiencies in the United States, these fast food companies typically target lower income and working class consumers by promoting their products to be more affordable and convenient. And again, as I mentioned before, this leads to high rates of chronic diseases. What many of you may not know is that these same fast food brands position themselves to be aspirational brands in lower to middle income countries, as they have a hard time competing against local supply chains that heavily focus on fruits and vegetables. Therefore, in these countries, they typically target middle and upper income consumers as premium brands and price their food higher when compared to local, healthier alternatives. This is one of the big reasons why the rates of non-communicable disease are reversed in low to middle income countries, and they have higher rates of obesity, diabetes, and heart attacks in middle to high income range group. Another strategic tactic that these large companies use to control the narrative is through their influence on research. This influence can take several forms, including direct funding, in which the industry funds the research directly, where they downplay the harmful side effects of their products and emphasize benefits to ensure sales and profits. They manipulate universities and other research organizations that are involved to ensure that they are publishing favorable results while suppressing any negative findings. One way they do this is by ghostwriting articles in peer-reviewed journals under the names of people working at these large academic influential institutions. Another way to influence research is by creating front groups that give the impression of being independent organizations but are really funded by corporations to promote industry-friendly narratives while criticizing any research that might harm their products. The tobacco's industry influence on research is probably the best known, but it may surprise most people that the sugar industry's influence on food policy has had a similar, if not worse, impact on the incidence of non-communicable disease in the population, and their role in creating the food pyramid and food plate by the government. Here's the story in brief. Early research in the 1950s was already starting to show a link between sugar and heart disease. The sugar industry wanted to get ahead of this data, so they formed the Sugar Research Foundation, ostensibly to assess the impact of sugar on non-communicable disease. Over the next decade or so, they published tons of articles in prestigious journals questioning the impact of sugar on heart disease and blaming it on fat and cholesterol as the causative agent. By sowing this confusion, not only did they avoid all regulation, but they also managed to cement the government guidelines to emphasize a low-fat diet. The modern equivalent of the Sugar Research Foundation is called the Sugar Association, and it continues to influence research and deflect blame to cholesterol as the causative agent of non-communicable disease. Trade agreements significantly impact commercial determinants of health by shaping global market rules that privilege corporate interests over public goals. Trade agreements can shape markets of entire economies by weakening regulatory power and privatization of government-run services, expanding protection of intellectual property rights, allowing manufacturers to sue governments, including for life-saving medications, to maintain their profits, and using global supply chains to avoid taxes. The flowchart shows some of the ways trade agreements widen health inequality. Trade agreement is probably one of the many reasons why insulin is much more expensive in the United States than in other countries. By the way, if you want to review these flowcharts, they're available in the written version of the article on pcplens.com. Parasites don't kill their host. They keep it just sick enough to feed off it. This table shows you the similarities between a biologic parasite and a commercial parasite. For a biological parasite, the host is the human or the animal, while for the commercial parasite, the host is the consumer or the public health system. As a survival strategy, the biologic parasites extract nutrients without killing the host, which is similar to commercial parasites extracting profit from the system without collapsing demand. Both types of parasites have developed mechanisms to evade detection. In the case of biologic parasites, they have mechanisms to avoid immune detection, while in the case of commercial parasites, they use a combination of tactics including PR, corporate social responsibility, and lobbying to evade regulation. Both types of parasites manipulate behavior. Biologic parasites manipulate behavior to ensure that they can be transmitted between hosts. Similarly, commercial parasites engineer consumption through marketing and pricing to get more people addicted with their products. Both types of parasites cause harm. In the case of biologic parasites, it impairs host function, leading to other infections, while commercial parasites drive chronic diseases. And in the case of biologic parasites, the host bears the cost of the disease. Similarly, for commercial parasites, the health system and people bear the economic and clinical costs. The greatest challenge to improving health is probably in the tension between wealth and health creation. As long as we have a system in which companies prioritize profit over well-being, extract profits while manufacturing disease-causing products, all the while undermining any efforts, including regulation, to rein them in, the health of the population will continue to get worse. And this is the dilemma doctors, especially primary care physicians, face today. We are fighting market budgets that run into billions of dollars. There's very little time to spend on educating our patients, and even if we do, the system is stacked against us. All this while, the controlling narrative to make doctors responsible for improving patient outcomes or face financial penalties. You can find a written version with references to the material and audio podcast version on pcplens.com. If you like this video, please sign up on pcplens.com so that you don't miss the next episode when it's published. Thank you for watching this video. Take care and goodbye.